Hi, my name is Melinda Thompson, and welcome to Nursing 443 Community Health. Today, I will be doing a teaching presentation on diabetes. I will be speaking to two different types of patient, one that is a newly diabetic and one that is uncontrolled. They're both around their middle age. But before we get started, what is diabetes? Diabetes is a disease in which the body's ability to produce or respond to the hormone insulin is impaired, resulting in abnormal metabolism of carbohydrates and elevated levels of glucose, which is found in our blood and in our urine. And that's the first thing that we need to know. Secondly, what are some signs and symptoms of diabetes that we need to know so we can check our blood sugar to make that determining factor if we need to make a doctor's appointment to discuss? Some signs and symptoms would be frequent urination, excessive thirst, blurred vision, extreme fatigue, increased hunger, weight loss. Some diabetics even say that they have a feeling of pins and needle in the bottom of their feet. So make sure you watch out for things like that. And if you're experiencing those things, we're going to make sure that we check our blood sugar, right? hmm Secondly, let's look at our food tray. The diabetes portion plate. This is a really good tool that you can utilize to make sure you're eating healthy foods. First is 1/4 of whole grains and starches. It's important that we fill our plate with grains and starches, such as whole grain breads and high fiber, cereal, brown rice, pasta, potatoes, and dried beans. Secondly, we make sure that we have some good protein in our diet. Things like lean cuts of beef or pork, fish, shrimp, eggs. My favorite would be salmon. Thirdly, we want to make sure that we eat non-starchy vegetables and about a half a cup of that. You can do zucchini, you can do tomatoes, broccoli, which is one of my favorite as well too. So this is important to know of what to put inside of our bodies so we can maintain our diet and exercise, because we also know obesity is also a risk factor for diabetes. Now, let's find out how we can check our blood sugar. Due to COVID-19, I do not have a live patient with me, but I do have the utensils here that I will be utilizing to make sure that we can check our blood sugar. I have my glucometer here. I have my test strip. I have my lancet, and I also have the device itself. I have an alcohol swab, and we have to make sure that we clean our hands. So that's first and foremost, is to clean our hands. And I'm going to demonstrate to you how to check your blood sugar. And as a nurse, we have to make sure that we ask our patient to demonstrate it back to us before they even leave our presence, okay? So now what we're going to do, now that we cleaned our hands and they're all dry, now we're going to take our lancet, open it up, and it has a little needle here. We're going to place it in the device, and we press down until we hear that little click sound. There we go. And then you're going to place the top on it. And on the top here, it has some numbers. On the numbers here, I have it set for 5, and you can turn this little device here to set it on a number. Basically, you're checking, this number is here to determine how deep it's going to be pricked into your skin. So if you have those rough fingers, you want to put it on a high number. If you have soft fingers like myself, it's okay to put it on a low number. Okay, and then you're going to pull it back. There you go. Then you're going to take your test strip and you're going to place it inside of the glucometer. And nowadays, I'm starting to see often is the Freestyle Light, which is the one they have on the market today. Then you're going to take your alcohol swab, and you're going to wipe off your finger. And it's really important to only prick the finger on the sides, only on your sides. If you prick your finger here in the middle, that's where we pick up our things. And that usually is the spot that's really tender and it can hurt. So we don't want to never use where our fingerprint is at. You always want to use the sides of your finger. You're going to take your utensil, your device, you're going to press in the button. You heard that? Then you want to milk the blood, pick up your device, and then you want to catch that blood. And the number that we're looking for is anywhere between 60 to 110. Some facilities actually have different numbers, but the majority I always see around 60 to 110. And you want to look and wait to get that good reading. Wonderful. Okay, I got about a 69, so that's pretty good for me. So that's how we check our blood sugar. We want to always make sure that our patient demonstrate those things back to us before they leave our presence. That's really important. You want to ask them, do they have any questions before they leave you? Those things are really important. Diet and exercise, and make sure we always stay in constant contact with our patients. Make sure your number is truly available so that your patient can reach you as a nurse. Finally, I will be placing this here on the YouTube channel, my YouTube channel, and I'm asking all of my diabetic friends and patients out there to go to my site and give me your feedback. Let me know how you feel about my presentation today. And I'm going to be posting some questions as well. And I have about 5 questions that I want you guys to answer. And once you answer that, give me a little feedback on it. Let me know what you think. And the 5 questions that I'm going to be posting will be: how would you rate the overall presentation delivery? Was the presentation easy to follow? Do you feel confident checking your own blood sugar watching this presentation? Did you find the presentation helpful? How would you rate the presentations and sequence? Did it flow for you? I want to thank you all so much for giving me this time and this opportunity to discuss with you about diabetes. I hope that you found it educational, and most importantly, let's wash our hands. Thank you so much for your time.